Good. So lovely to officially welcome you. Thank you for being with us. If you know how to edit your name and put the place that you're calling in from after that, that would be great. We'd love to see where you're from. And we'd love you to be involved with the discussion and share questions and thoughts after we've heard from our two guests today. Elaine Morgan from Greater Manchester Combined Authority, and Andy Frost from Share Jesus and Gather Movement. So thank you again for joining us. We're thinking today about what it is to work collectively. And as we think at Gather Movement about spiritual, social, and cultural transformation of our places, we've been encouraged to think about long-term planning, to think about what a 10-year plan looks like for our places. Often I think as church leaders, we perhaps don't think enough about that or ambitiously about that. But today we're thinking about some ways that help us to be really ambitious in our vision and in our execution of that vision. So we're going to hand over to Andy first of all, just to help us think through what is an impact network and how can this help us be more ambitious in our places.
So we've got a few slides we're going to show as well. I've been really encouraged by a book by a guy called David Evertman, a really helpful book exploring the idea of impact networks. It isn't a Christian book, but a really helpful book exploring that. I think we're looking at our place. We want to see impact at different levels. We're thinking biblically or reflecting theologically on this, that actually whenever Paul goes to a region, there is more than a spiritual impact. There's a social impact, there's new communities of birth, there's a cultural impact, there's an economic impact. And David Evertman kind of writes, exploring what these networks are. And he argues this, that networks, the next slide down, are webs of relationships connecting people or things. But when they seek to address social and environmental issues, they are called an impact network. This book's been really helpful. There's a great online kind of workbook you can do as well, some great resources. We'll put the link in the chat afterwards. I would go further to say, actually, when they seek to address social, spiritual, and environmental issues, they are called impact networks. And when he explores this, I know that actually there are some issues that are quite simple to resolve, and there's some that are more complicated, and there's some that are very complex. So to give you an example of a simple issue to be resolved, might be something that can be definitively solved, the clear beginning and end. So an example might be, if somebody in your town or city becomes homeless, the church has a spare manse or a spare building, the person moves in, and it's resolved, a simple issue. A complicated issue involves many moving parts, but they can still be defined and they can be understood quite easily. So an example there perhaps would be, in your town or city, lots of people were becoming homeless. There are lots of empty houses owned by different stakeholders that need repairing. It's complicated, but it's quite simple again as to how you resolve that issue. But many of the things we're facing today are complex issues. They are difficult to define. They have no clear beginning or end. They also have no readily apparent solution, and we cannot accurately predict the path ahead. So we have to kind of keep navigating and adapting to what's happening in our different circumstances. So taking the same analogy, the simple idea is someone becomes homeless, gets given a manse to live in. The complicated is people becoming homeless, and there are some resources in your place and houses available. The complex example could be this. There's a growing trend towards people becoming homeless in your city. There's a lack of housing. The causes are complex, including a lack of jobs in the area, with a big employer thinking about leaving the city. There are also mental health challenges and a culture in the city of drug abuse and addiction. That shows a kind of complex idea where things are much more difficult to resolve, and there's no one simple way of doing it. You have to keep modifying, adapting, and changing how we do it. When it comes to these kind of issues, we need to be thinking much more about how we create networks to resolve these things rather than working in our own different silos. He argues in the book there are three main different kinds of impact networks. The first are learning networks, which are about connecting different people from different groups, different spheres, and you're just about learning together. So an example of that could be, I guess, if you were thinking about a church unity group, where we're coming together regularly to have some teaching and reflection, perhaps on leadership on a certain issue, that'd be a learning network. You're coming together just to learn. Action networks are those who are kind of coming together to not only learn, but also to act on it as a result. So it could be a group of people coming together in a place where they're learning about food poverty, and they're working out what they could do collectively on food poverty, and they're doing different action things around that. That'd be an action network. But movement networks are when we're linking different learning networks and different action networks together, become almost a movement for a place. So going back to the example of homelessness, it requires many different sectors working collaboratively. It really is a movement network where you're linking together different learnings, different actions from different areas, where you have a much more holistic way of challenging what's going on and moving things forwards. In the book, very helpful, there's a link we'll share at the end of this. It just kind of gives a very kind of clear idea of, as you're thinking about your place, as you're trying to build kind of bridges and relationships, if you want to think long term about your place being transformed socially, culturally, spiritually, then who are you going to work alongside? So to actually create these networks, you should have some kind of a charter. So I'm based in London. So in London, it's a complicated place. It's not a very small village. It's about 9 million people. Lots of different boroughs, lots of different groups working collectively. And we've gone with beginning to work on what does a network charter look like from kind of faith point of view for London. And it's about three things, but actually, first of all, what is our purpose? What is it we're really trying to achieve and see happen in our place? What is the purpose? And being really clear on that. And the clearer our purpose is, the better. The second of all is the principles, is what are the principles and the values by which we're going to kind of work and operate as a group, what they look like in our context, and be very clear on those things, so everyone understands what it is to be involved. And the third thing is, what does participation look like? And often we can have meetings, people come to a meeting and leave again, but participation is more about actually what is the buy-in, what is people's commitment and kind of journeying alongside this over the longer term. It's almost like working out a network charter for what you want to achieve in your place. So I'm still exploring this stuff here in London, but I found it really helpful, that book, and just the idea that there are many, many complex issues where we can't work in our own silos or our own independent thing. We need to work collectively across sector and across different spheres, but thinking through what is our purpose, what are our principles, and how we're going to encourage participation, and what it might look like to have a movement of movements, a network movement.
Wow, Andy, that was absolutely fantastic. What a great introduction to this topic of collective working, thinking about using the language of impact networks, what it means to come together and collaborate. Obviously, at Gather Movement, we connect with lots of churches that are working collectively in their places. They have church unity movements, our church networks, and it's exciting to see those relationships developing over time. We've got Alison on the call here, where their church leaders in York have been meeting together every week, I think, for over 20 years. Is that right, Alison? And yeah, it's amazing what can happen when we actually draw ourselves together as churches. I think we've also seen other tools as well that are beginning to really play a role in helping us be an effective impact network. You do get in touch with Gather to find out more about mapping and how we map what churches are actually delivering in their communities. That's another important, dimension to understanding the impact network of a collective of churches. But I want to go on to Elaine now, and to just get Elaine's experience and wisdom on this subject. So Elaine, it was absolutely brilliant to meet you at a recent event in Greater Manchester, where it was a training course, wasn't it? And an invitation for people across the city to learn more about how we work together across the multiple organizations and across, to try and solve complex problems. So first of all, just tell us about your role and tell us why you were at that systems leadership event in Manchester.
So my name's Elaine Morgan. I work at the Greater Manchester Combined Authority. I work in what's called the Public Service Reform Team, but actually my role is around tackling food insecurity, poverty reduction and financial resilience. I would say that the reason I attended the training session was prior to kind of my current role, I was employed at the Combined Authority to look at what it says on the tin in terms of our team, which is public service reform, and how we start that transformational change, noting that we feel like the public sector is probably broken at the moment and we need to do something differently. So I was involved in some early adopter sites. We had a Vanguard consultant work with us, and we were looking at system change and system leadership. So it all became very relevant. I think we all felt that afterwards you become part of a cult, in effect. You feel like a bit of an outsider because you know what it would take to make change, but you struggle to get everybody else on that journey. But I think the pandemic basically led to a bit of a shift in people's thinking across Greater Manchester. Right. And then subsequently, there's been a number of different programmes of work to try and look at that cross-sector collaboration and how we could build on how everyone came together during the pandemic in terms of a response, and what did we learn from it and how we can start to do things differently across Greater Manchester.
Yeah. And one of the exciting, initiatives that's come out of that, I suppose, is this program to help skill people up in working across the different organisations, the system, as it's kind of notionally called. So, Elaine, obviously you're dealing with complex issues around food and food insecurity. Can you give us a bit more on how you see a city as being so socially interconnected?
Yeah, and I think, there's no priority in this, but I think one of the first things that we would say in Greater Manchester is around the economic synergy. So we've got 10 boroughs of Greater Manchester who work together to create a strong economic network. And this collaboration enhances the region's overall success and influence in terms of attracting investment and fostering growth. So I think the Mayor mentioned the other day, I think we're the fastest growing city outside of London at the moment. And I think that is down to that convening role that the combined authority play with the 10 kind of chief execs of the 10 local authorities, but also the role the Mayor plays in terms of that convening with the 10 political leads as well, which again is really important. You have that kind of direction from the top, but actually it's also about how we can take a bottom-up approach as well. Noting that it's communities and people that sometimes have the answers. I think as well, if you just look at Greater Manchester, you've got so much in terms of education and that research collaboration. So we've got 3 big universities and then some smaller ones in Bolton, Oldham, etc. And they collaborate on various projects. They drive innovation. They provide educational opportunities, and that benefits the entire city region. We've also got that cultural and social exchange. So we've got some real diverse communities in Greater Manchester who engage in cultural and social exchanges. They enrich the region's cultural fabric and they try and promote inclusivity, which we're really grateful for. Then we have digital connectivity. So Greater Manchester leverages sort of digital platforms to enhance communication and connectivity among its residents, and this digital footprint helps promote the region's strengths and attract talent and investment, and also to try and support that digital divide that's currently exists, I think, across Greater Manchester. And then probably saving the best for last, we have all our community initiatives as well. We have programmes like Warm Welcome Spaces, we've got over 250 in Greater Manchester. We've got the GM Live Well initiative that we're launching that provides essential services and support to foster a sense of community and belonging. So we're always looking for new innovative projects as well. So I would say those are some of the key sort of examples of how we are socially interconnected.
Yeah. That's a very helpful overview, Elaine. Thank you. And that those can be a bit overwhelming, all those different kind of networks of services and what people are doing. And yet it's been such a pleasure to work with you in a little project team to explore a project in GM. And what you've helped me discover is that actually, as you begin to connect with leaders in Greater Manchester, there's been a real willingness to offer some time to just meet and to talk about the issues that you're seeing. And so, as you say about this interest in the story from the bottom up, I've been overwhelmed actually by how interested people from all sorts of different organizations across GM have been willing and interested to actually hear the story that I've got, and for vice versa, for me to hear their story. And that's been part of a wonderful experience to me, but that's also part of the secret of this, isn't it? That actually we need to be able to tell a story. And do you have any thoughts on that?
I think you're just going back as well to your comment. What I've also noticed with some of the people that I've referred you into, it's not hierarchical either. I think that's what works really well. And I think that's something that we've really pushed for in Greater Manchester, is that that willingness to all work together towards a common purpose. and
Yeah.
to kind of leave your lanyard at the door. So there's kind of a blurring really of who is it that's actually supporting it. It's the organisations that basically have that skills, knowledge, to actually do that. So I would say that's probably key to some of the interactions that you're finding. And again, I would go back to the pandemic. That works so well in terms of that galvanising a collective kind of response across Greater Manchester.
Yeah, it's been a fantastic and encouraging experience. That something that might seem a bit intimidating, actually, it is wonderfully, really just does produce fruit. And I think, I suppose, coming as a church unity leader, I've been impressed with actually, as you form a strong partnership with a civic leader such as yourself, to then be able to go and knock on other doors and say, there's a couple of us that have kind of thought about this and we want to explore it with you. I think that adds sort of some strength, doesn't it? So this idea of going as a trio to different system leaders works really well. Yeah, great. Let's get a bit more into, some of the complex issues in our communities. I mean, love to know from your experience, your perspectives, Elaine, some of the biggest and most complex social challenges that you see in GM, and also, well, we'll get into system barriers in a minute, but talk to us about the big problems that you see.
I think the biggest one is around structural inequalities. And I think back in 2020, we launched an independent inequalities commission. And the sort of aim of that was to examine inequalities across the city region. And it's what we'd actually seen probably over the pandemic about who'd been kind of impacted the most. So there was a diverse membership, and we had some quite prominent thinkers like Professor Kay Pickett, we had Lord Simon Woolley. And the commission kind of reviewed all our evidence, and we did a call for ideas from local people, academic research, people who were working on equalities in general, and then insight from the business, public, voluntary and community sectors. And it came out then about some of the issues that we are experiencing around, I go through how we're socially connected, but when you start to look at the key themes that came out of some of the structural inequalities, the first one was economic disparities. So there was significant economic inequalities across the region, often rooted in historical, systemic issues such as unequal access to quality education, employment opportunities and economic resources. Health inequalities was huge. Again, varies widely across the region. We were a Marmot City region, and it really was a postcode lottery that literally you could live in Saddleworth in Oldham and sort of 10 miles away in Salford. The difference in terms of your life expectancy was about 10, 12 years, which was, huge. So, it was certain groups experiencing poorer health due to factors like socioeconomic status, their ethnicity, just said where they live. And I think addressing these health disparities required some targeted interventions and equitable access to healthcare services. We've also seen, and this is a problem we see all the time, and obviously, the project that we're working on as well is about access to services. So it's a barrier to accessing essential services such as transport, healthcare, including mental health, social support. And again, people in marginalised communities we see are disproportionately impacted by this. And I think we need to look at how we can start to improve that access. And some of the things that come out of that is how do we start to deliver services to people within their local communities. I mentioned before about, some of our great work we're doing around digital, but there's still a huge digital divide in Greater Manchester. And it's a significant barrier, especially within certain communities, especially our diverse communities who lack access to digital technologies, the internet. And again, this gap affects education, employment and access to information and services like healthcare services. And then just around a little bit around intersectionality as well. So we have inequalities often intersect and compound, meaning that individuals are facing multiple overlapping barriers based on their gender, ethnicity, socioeconomic status and other factors. And then it's very difficult then to address that because they're so complex, and that's why there's a real need to start working together because we need a holistic approach to that person. And then, we've seen over the summer some of the issues that still exist across Greater Manchester, despite a lot of work, is around structural racism and discrimination as well, and the problems that causes. And it still affects various aspects of our life, again, including employment, education, housing. And efforts to tackle these involve creating policies and initiatives that promote equality and inclusion, and we have to ensure that they're co-produced and co-designed. So Greater Manchester has some equality panels that represent a range of different cohorts, but they all come together as well, recognises that there are intersectionalities between these as well. So I would say those are some of the challenges, and it is around that structural inequality, I would say, the biggest issue.
That's amazing, really helpful. And also, I just find so encouraging that, a civic leader like yourself, representing an organization, is seeing these things, is wanting to, improve lives for everybody across Manchester. I think that's something that it's just such an encouraging message to hear across our city in Manchester. I'm just going to pull up a slide because I want us to dig in a bit more into this idea of barriers. When we see someone who's struggling in life, whether it be an individual or actually an organization or actually a network of organizations, we face these barriers. They're often invisible, aren't they? But they're nevertheless they're there. I don't know whether you can help us just sort of think through this, Elaine, but this was in the context of thinking about actually how we create something new in a system so that people can be helped. These 1, 2, 3, 4, 5, 6 barriers have been kind of identified. Can you give us any sort of quick explanation of how you see these existing and perhaps how we overcome them?
Well, it's interesting. When we did our public service reform work with the early adopter sites, we came up with it was called the Greater Manchester Unified Model of Public Services, how it would move further and faster. And I would say most of the 6 issues, we had 6 kind of system conditions that we needed to change in Greater Manchester. So they're kind of very similar to what you've got on here. I don't know if you would mind, but we've got, like, I think what we're missing is maybe things around place.
Yeah.
One of the biggest things we found was around geographical alignment. That, all services should really share a service delivery footprint and integrate their services within communities. We felt the neighbourhood level was the building block for things like local care organisations, for public services, for VCS FSE delivery. And we were looking at a neighbourhood kind of delivery of around 30 to 50,000 residents. So all services can describe how they align capacity and capability at this level, so they get a mutual benefit. But it focused on activities, that will basically sort of at a neighbourhood level then stack up to a locality level. So I think that's the only one that's missing from there that we had that was slightly different, because the leadership exercised primarily within organisations, that was a really big one. So we looked at leadership and accountability and how we would have integrated leadership through accountability, performance and new governance structures that then reflect the government, the geographical alignment of services. But we were looking at joint decisions that could be made across organisations at a spatial level, with an emphasis on leading for the people and the place, as opposed to purely on the organisation and the functional basis. So we felt that, when we did our work, it was very difficult. Each organisation had a different purpose in terms of why they were doing something. So how do you get that common purpose across all leaders, hold them all to account, but get them working within a system at a place level that basically, responds to the needs of the people and the community as well. We also said about leaders as well, instead of kind of giving direction and giving kind of instructions, that really what they should do is give permission to frontline workers to do a good job. What we found was that frontline workers knew what needed to be done for people, but felt constrained within their own organisation. So it was about leaders actually giving people permission to do what they felt was right for that person. We said it was do what matters, within the context of making sure that you don't break the law. But apart from that, they could do anything. So that was quite interesting, in terms of sort of giving up that power, I would say, that they have in terms of leaders. And then the other role for leaders as well, we felt was being there to support and sort of help remove challenges and system barriers at a level that frontline workers couldn't respond to. So how could they take something? We had an example in terms of we had a housing example in one of the areas that we worked in, where if you'd had arrears from years ago, you were basically you weren't allowed to join the rehousing waiting list ever again. And actually, something could have happened to you earlier on in life, bit of bad luck, and you'd built up some arrears, and that basically excluded you for life from being able to ever apply for a social housing property. So it was something that we probably couldn't deal with at a workforce level, but what we could do is get senior leaders to speak to central government about changing their allocations system. And we did trial a different pilot in two particular areas in Greater Manchester to look at resolving that. So it's things like that that we were trying to adapt leaders to. The stuff around One Workforce, exhaustive frontline teams focused on managing demand and risk. I think we all wanted to look at One Workforce in Greater Manchester. And we say one public service workforce functioning together, but actually that could incorporate private sector, it could incorporate VCFSE sector, and about how we remove those job titles and those organisational kind of boundaries that people work within. So how do we start to drive effectiveness? How do we focus on prevention? And a lot of that was around giving frontline workers time to deal with people. They took a person-centred approach. I think we found that there were a lot of targets that basically ended up with sort of perverse behaviours in terms of people trying to meet those targets. They only were given 6 weeks to work with the family and things like that. And actually that didn't work for the frontline worker or for the families themselves, because they just found it was repeat demand backwards and forwards. So it was all about giving people time and based on a new relationship with systems as well, taking this person-centred approach, being given the time to deal with them holistically, look at them in context, not just about the presenting issue. And there's also a common culture across organisations displayed through shared assumptions, values and beliefs that enable that way of working. So it has to be sort of brought in across all different organisations as well. So that was another one that we sort of looked at. I think shared resources, I think you've put there about community organisations operating at the margins on short-term funding. I mean, Andy Burnham talks all the time that the VCFSE sector have become in effect the sort of the third sector welfare state in terms of supporting people. And I think what we don't have is a clear understanding of the spend in Greater Manchester, whether it's public sector, VCFSE, and I think that's one of the things that we need to find out about, but also then a mechanism and put a mechanism in place where we all start pooling resources for the collective benefit of communities and for people. Looking at a single commissioning function as well, which pools budgets across all public services, health, VCFSE organisations, and looking at integrated core budgets that exist where relevant, that can support a change in terms of how we deliver services. I think what we found was in some instances there would be organisations that would invest some substantial amount of funding, but the benefits would be seen elsewhere in another organisation. An example of that was we put a lot of work into kind of what you would call frequent flyers who placed a lot of demand in hospitals and on blue light services. And once we started to deal with those people and give them time, although particular organisations were investing in that person, that employee, that frontline colleague to do that work, it was actually the blue light services that actually benefited from, not being called out as much. So there's always a bit of friction, I think. So it's about how do we bring on things like your financial services, your back office services like HR, to kind of work with that change as well in terms of finances and funding work.
Yeah. This is all really helpful, Elaine, and I guess this is a big part of your job, isn't it, in terms of reform? And it's fascinating to hear that you are working and seeing these system barriers and thinking about how to overcome them. I know as church leaders, many of us would see these issues ourselves in our own organizations. As leaders of Christian charities as well, we would be aware too of some of these issues. And so I think it's encouraging just to hear that we can, first of all, identify these kind of system barriers, and we can begin to talk openly about overcoming them together. And it's great to hear, what a sort of in-depth understanding you have of, from a civic authority point of view, how you overcome some of these things. And exciting, I think, to think about a church network, about how it can begin to join in with the conversation, addressing these barriers and dealing with them, so that we can see people getting the help that they need. We can see communities progress and be helped. I think one of the exciting things we should mention about GM is GM Live Well, because I think that is about leadership rather than being exercised within organizations. It's really kind of systems leadership, impact network kind of style of leadership, isn't it? Can you just give us a minute on explaining that to us and how it's working? Oh, you're on mute, Elaine.
Sorry, Mark. I think GM Live Well has evolved, and what I would say is it's when the mayor was elected for his third term, he had a number of mayoral priorities, and one of them was GM Live Well. And basically, it's about everyday support in every neighbourhood for health creation, social connection, and economic inclusion. I think his original idea was around how do we start to make things like, places where people have to go, such as job centre pluses, how do we change them into live well centres where people can get support? But I think he started to recognise that these places already existed, and actually they weren't the sort of formal places that we thought people went. It was actually these community hubs, normally run by VCFE sector organisations. And I think, he started to recognise then that, how do we start to harness that, but also make sure then that we invest in those places that people go to for support as well. So it is a new era in Greater Manchester. It all links into his other mayoral priorities as well, where he wants to make sure everyone has a good, secure home, everyone has a clear path in life and a good, secure job. So that's through the MBAC, where young people now have a choice where they don't have to go down an academic route, they can go down a technical route in terms of qualifications. Good transport where people can get around and have the ability to live well. And also we've got our safer, stronger communities as well, where people can kind of live from the fear of crime, which I think again is quite important, that perception of where you live. So it's evolving. We've got some big opportunities. It's about galvanising the 10 local authorities and cross partners to come on that journey with us. We're hoping it'll bring some funding as well, through lottery, central government. So there's some really good opportunities here where we can look at, localities remaining at the cutting edge of public service reform nationally, how we start to look at the strength of local neighbourhood prevention models, because we feel that we're currently sort of working at crisis point, and we deliver quite reactively instead of proactively. How we can build on an existing and vibrant GM Live Well community. So we have identified so much good work in Greater Manchester that would sit under this banner. How it links into employment and skills devolution, and how we can make devolution in Greater Manchester work for every locality and for every resident. I think that's quite important as well. So we can always share details. There's so many webinars on this. We've got a big event on March the 19th, really well attended, including Andy Burnham, our new chief exec. So we can share details of that if anyone lives in the locality would like to book on and attend. It's a big in-person event, and it is led by the community. We're trying to take a bottom-up approach with this and drive it by people within our community who know what is required in Greater Manchester to make it a thriving place.
Yeah, thanks, Elaine. There's a great phrase, isn't there, that says nothing about us without us is for us.
Yeah.
Which I think is the spirit of what systems leadership is about. It's saying that actually we're not just coming up with a great idea and trying to make it happen through the system, but we're actually involving our communities, those that need the support and help. And in that sense, we use the word co-design. We want people with the lived experience of these issues involved with helping develop the services. And then the systems leadership is about co-production. It's about, trying to address these complex needs, recognizing the church can't do it on its own. The health system can't do it on its own. We need to be integrated and joined up so that, people can get the help and support they need. So on that, what would your thoughts be about faith organizations? What would you suggest as the next steps? And I guess to kind of convince people on the call here that we should be thinking about impact networks and systems leadership. What would you say should be our next steps?
I think my own personal kind of experience. So I used to do quite a bit of, I've done a lot of volunteering as well. So I've done a bed for every night. And what I've always felt was, even sort of a step before that, the faith sector were already there delivering some kind of service to homeless people. And I always feel that you don't raise or amplify your work enough. That's a real issue. How do you get it in front of the people where it matters, I suppose? I think you did ask me one of the questions about, how can we get faith organisations to engage with this? And I think that sometimes as well, it's flipping it on its head really, and sort of asking, how can we start to engage with you? Just because I think some of the principles around how we want to work, you already exemplify in what you do. And I can name, so many examples. You're based in communities. We've done this piece of work, haven't we, Mark, where I've connected you up to Miriam, the early years lead. And when you've mapped how many sort of childcare offers in terms of toddler clubs, etc., are taking place in churches across Greater Manchester, it's absolutely huge. And again, people probably walk there because they're in walking distance. It's led by people in the community, know what they need. It's on at a certain day that maximises the families that can attend. So I just think, actually, without thinking, you're doing it. And I think we could learn something from how the faith sector kind of operates. So how do we start to raise, amplify how you work, how you operate across Greater Manchester? And then how do we connect you into the work a lot more? And then how do we not just connect you, but how can we start then making sure that you are co-designing and co-producing the work based on, the successes that you've had through various things like homelessness, the support that you give to children and families, etc., food offers, it's just absolutely huge. So I think for me, those are kind of the top three, really.
Yeah, that's really great. And again, we're so grateful to you because you have, introduced us to leaders across GM that have enabled all sorts of things. You mentioned Miriam, and she's arranging commissioning of getting the mapping done for all the churches across Greater Manchester, over 1,000 churches and other faith organisations too. So that's a huge breakthrough, and I suppose it's a bit of a testament to knocking on doors and meeting with civic leaders and having these conversations. And as you've said, you've You're talking about, GMCA actually making the effort with faith groups. That's a great example, isn't it, where actually you've really enabled so much through the faith network just in the last few months. So we're very grateful for that, Elaine.